Every year, over 14 million Americans aged 65 and older fall. That is 1 in 4. And for too many of them, it is the beginning of the end. Falls are the leading cause of injury death in this age group. In 2021 alone, nearly 39,000 seniors died from fall-related injuries. The cost to the healthcare system exceeds $80 billion a year. So what does every doctor recommend? Walk more, get your steps in, stay active. But here is the problem with that advice. If your knees hurt, if your hips ache, if your balance already feels shaky, walking can actually increase your fall risk. And a Cochrane review. Analyzing dozens of studies found something surprising. Walking programs showed uncertain effects on preventing falls. The evidence just was not there. Yet there is one exercise that the research keeps pointing to over and over again. And you can do it sitting in a chair in your living room. It is called wave hands like clouds. It is a single Tai Chi movement, and surgeons at Cleveland Clinic, Mayo Clinic, and Harvard Medical School are now calling it one of the best things a senior can do for their body. Better than walking, better than most gym exercises, and far gentler on your joints. Before you dismiss that as some slow-motion waving of arms, consider what the science actually found. A 2022 study published in Sports Medicine and Health Science attached EMG sensors to people performing Tai Chi movements, including cloud hands, and compared their muscle activation to walking. The results were not even close. Knee extensors fired at 430% of walking levels. Hip muscles activated at 240 to 320%. And the integrated muscle activity in the quadriceps reached 610% of what walking produces. 6 times the muscle work. From a seated position. The reason comes down to how your body moves. Walking is a forward and backward motion. You step, you swing, you repeat. It recruits 5 or 6 muscles in a cycle that barely changes. But wave hands like clouds adds 3 dimensions that walking completely ignores. First, rotation. Your torso gently turns side to side, which fires the obliques, the deep core stabilizers, and the muscles along the spine. Second, lateral movement. The subtle weight shifting from side to side activates hip adductors and abductors at 2 to 3 times walking intensity. Third, upper body engagement. Your arms move in slow, unsupported circles, which recruits the shoulders, biceps, triceps, and forearm muscles that are completely dormant while walking. In total, cloud hands engages 14 or more muscle groups simultaneously. And because the movement is slow and controlled, your muscles work eccentrically and isometrically, meaning they lengthen and hold under tension. That kind of contraction builds the functional strength that actually prevents falls. Now here is the part that matters for anyone with joint pain. During walking, the force on your knees reaches 3 to 4 times your body weight with every step. During Tai Chi, that force drops to roughly 1.2 times body weight. You are getting a dramatically stronger training stimulus with about 1/3 the impact on your joints. This is exactly why surgeons are paying attention. Dr. Ardashir Hashmi, the section chief of geriatric medicine at Cleveland Clinic, watched a Tai Chi researcher bring wheelchair-bound patients on stage at a medical conference. One of them walked across the stage for the first time in years. Another had stopped using supplemental oxygen after 6 months of practice. Tai Chi is now the #1 activity Cleveland Clinic recommends for older patients, and Dr. Hashmi started practicing it himself. At Mayo Clinic, endocrinologist Dr. Robert Wermers put it plainly. He said only one exercise has actually been shown to prevent falls, and it is Tai Chi. At Harvard Medical School, researcher Dr. Peter Wayne, who has led over 30 NIH-funded studies on Tai Chi, described it as meditation on wheels. You get the mental clarity and stress reduction of meditation combined with genuine physical exercise. Fall prevention numbers back all of this up. A landmark. 2018 study published in JAMA Internal Medicine followed 670 seniors at high risk of falling across 7 cities in Oregon. After 24 weeks, the Tai Chi group experienced 58% fewer falls than the stretching group and 31% fewer falls than a group doing multimodal exercise, which included balance training, aerobics, and strength work. Tai Chi beat everything. A follow-up study went further. Serious injurious falls, the kind that send you to the hospital, dropped by 75% in the Tai Chi group. If you're finding this helpful so far, hit subscribe. We cover exercises and wellness tips for seniors every week. Now, the benefits extend well beyond fall prevention. A Tufts University trial found that Tai Chi worked just as well as standard physical therapy for knee osteoarthritis, and patients reported feeling happier overall. 12 weeks of practice reduced arthritis pain by 35%. Research from Harvard found Tai Chi improved memory and executive function in older adults, and a UCLA study showed it reduced chronic inflammation more effectively than cognitive behavioral therapy. So how do you actually do this exercise? You need one sturdy armless chair. Sit toward the front edge with your feet flat on the floor, about shoulder width apart. Keep your back straight but relaxed. Now raise both hands in front of you, one near your lower belly and one near chin height. Begin slowly rotating your waist to the left, letting your arms follow the movement like clouds drifting across the sky. One hand rises as the other lowers, making gentle circles. Then rotate to the right and let the arms reverse. The key principle is this: your arms do not move on their own. Every motion is driven by the waist. Inhale as you turn one direction. Exhale as you return. Keep the movement slow, smooth, and continuous, like you are stirring honey with your whole body. Start with 5 minutes a day. That is it. Dr. Paul Lam, whose Tai Chi for Arthritis program is endorsed by the CDC and has trained over 2 million people worldwide, recommends building gradually to 15 or 20 minutes over several weeks. You do not need a gym membership. You do not need special equipment. You do not need someone to spot you. You just need a chair and 5 minutes. One movement, 14 muscle groups, a fraction of the joint stress, and the only exercise that surgeons at 3 of the top medical institutions in the country agree is proven to keep you on your feet. We have plenty more where this came from. Click the video on screen and keep going.